Hey everyone, my name is Cody Dudgeon. I'm a registered physiotherapist and I practice out of Toronto, Ontario, Canada. I'm making this video today to help all of you out there who have arthritis and who are contemplating getting a joint replacement. Whether it's your shoulder, it's your hip, it's your knee, whichever joint you have arthritis in and you're thinking about getting a replacement, this video is going to help you out. So first off, if you have arthritis, you know the pain that comes with it is devastating. Your range of motion restriction and how you can move your shoulder, your hip, or your knee is very restricted. And the activities you do on a day-to-day basis that make you who you are and allow you to function and thrive, they're impacted greatly. So with that in mind, if you've been recommended to have a joint replacement by your doctor or friend, or if you've Googled it yourself and you're just contemplating on getting one or not, 3 things you should focus on. You need to ask yourself. The first one is, what is your pain level like? So we like to rate pain on a scale of 1 to 10, 1 being no pain really at all, and 10 being the worst pain imaginable in life. You need to ask yourself, what is your pain on a daily basis? Is your pain on kind of a 1 to 3, 1 to 4, which is manageable, right? You're still able to do most things. You're not popping pills very often. You're still able to live your life in such a way that you want to and that makes you happy. Or is your pain getting up there around 7, 8, 9, or God forbid 10 out of 10? This is excruciating pain and you're not able to live your life enjoyably at all. So the first thing you have to ask yourself is what is your pain like on a day-to-day basis? If it is really high and it's that 7 to 10, then probably you should be leaning towards getting a joint replacement. If it's lower and it's manageable, well, maybe you don't have to undergo surgery and go through all the pain that goes with it. Number 2 is, what is your range of motion like? So if we're talking about your shoulder, okay, are you still able to reach up overhead? Are you able to take jars out or plates out from your cupboards from the top shelf? Are you able to still do your hair in the morning? Are you able to do up your bra? These are things you have to ask yourself. If your range is really restricted and you can't do these things, what kind of life is that to live? If we're thinking about our knee or our hip, are we able to sit in a lower chair or couch for a long period of time? When we go to get up, are we really, really stiff and really painful? When we walk, are we walking with our knee bent? Right? When we walk, both our legs should be completely straight. A lot of the times when we get arthritis in our knees, we're walking on a bent knee, and that's very unhealthy. It leads to a lot of pain, and it leads to not just pain in your knee, but it also affects your hip, your low back, right up your body. Okay? Another thing is, are you able to kneel? Right? A lot of the times we have to squat down to wash or clean something. We have to kneel on our knees. If we're painting, something like that. It takes a high degree of knee bend to be able to do these things. If you don't have the range and are unable to do them, what kind of life are you able to live? Maybe not being able to kneel or squat down low, maybe that doesn't affect you at all. These are things you have to ask yourself, right? So what is my range like? If we're talking about our hip, are you someone when you walk that you limp a lot, right? We see these people walk and they have a really painful limp, or we see they always kind of lean to one side when they're walking. That's a big sign of arthritis in our hip. Are you someone that is impacted like this? Are you unable to cross your legs anymore? Do you have trouble going up and down stairs? These are all more range of motion related issues with regards to arthritis. So range of motion, how's your range of motion impacted? If you're still able to move your arms, move your legs, move your hips to a fair extent, then probably you won't need a joint replacement at this stage, right? You're still pretty functional. Third thing we have to think about is our daily activities. Now, they can be something as mundane as doing the dishes, or they can be something that makes us who we are, such as gardening, golfing, whatever your daily activities, your hobbies are that make you who you are. Are they impacted? If your arthritis is limiting you, and let's say you used to golf 3 times a week, and now you can't golf at all, you can't even go out and practice putting, right? That's a big deal, right? Our activities of daily living and our hobbies, our participations, they're very dear to us, right? Not just on a physical level, but emotional, right? They make us who we are. If you live by yourself, you need to have, your dishes washed, put away. You need to have your laundry done. You need to have your food prepared. If you can't stand in a kitchen for more than 5-10 minutes and prepare your food, how are you going to eat? If your arthritis is so bad that even, an activity such as even sleeping or lying down in bed, if you have trouble even doing that, what is that going to do for you, right? Sleep is very important. And a lot of times with arthritis, it's worse first thing in the morning, but can also impact us when we're resting. So I just want to sum up the 3 areas that we should be thinking about when we're contemplating whether or not to get a joint replacement. So to start, arthritis, most commonly when we're thinking about a joint replacement, is either in our shoulder, our hip, or our knee. So this video applies to all 3 of those. You've got some information or recommendation to get a joint replacement done. There's 3 questions or 3 areas you have to think of or ask yourself. The first one is pain. What's my pain level like on a day-to-day basis? Is it manageable? Do I have to pop a lot of pills to get by? Is it excruciating and I get no relief? If it's manageable, right, you're not going to want a joint replacement right now, right? You're not going to need to go through it. If your pain is excruciating, you can't even sleep, you can't get rid of it no matter what you do, then you're going to want that joint replacement. And I'll tell you why just in 1 second. So the first one is pain. What's your pain level? Second one is your range. What's your range of motion like? Again, shoulder, knee, or hip, right? Are you able to squat down? Are you able to go up and down stairs? Are you able to sit for a long period of time? Are you able to reach up overhead, do your hair, reach for dishes in the top cupboard, things like that? If your range of motion is great and you have no restrictions, you're not going to opt for a joint replacement. But if you can barely lift your arm, right? If your knee is really stuck in one position, your hip, you can't go up and down stairs or anything like that. If your range is just really, really restricted, you're going to opt for a joint replacement. So third and final is, how are your activities of daily living impacted? Activities of daily living, they differ based on who you are. If you're someone that's a homebody, your activities of daily living are going to be more home-based things, right? Now, what is similar to everyone that's an activity of daily living is doing your hair, doing your dishes, cooking your food, making your bed. Are you able to do all these things that you need to do every day? Or are you really restricted or unable to do them because of your arthritis? Another thing that goes into your activities of daily living is, let's say you're very active and you have a hobby such as golf or lawn bowling, right? Going out with your grandchildren, right? Are you able to do these activities like you would before you had your arthritis or before it got to this stage? If you're able to really do everything you need to do in a day and you have low pain, your range is great, and you're able to do your activities, then you have no reason to get a joint replacement. You really don't. That's just the honest truth. You have really no pain, your range of motion is fantastic, and you're able to do all the activities you need to do. You don't even need to be thinking about a joint replacement at this stage. But what can happen is, over time, when we get up to 70, 80, 90, 100, we've had arthritis for such a long period of time that we do know it's degenerative. It does get worse over time, and there does come a point where our pain is just so great, our range is so restricted, our activities we do on a day-to-day basis, we're just not able to do them anymore, that we're going to opt for a joint replacement. Now, out of all the clients I've had, out of all the family members, acquaintances, clients I've had over the years that have had arthritis, everyone has told me the exact same thing. The pain during the rehabilitation process after having a joint replacement, right? So the days, weeks, and months after having the joint replacement surgery, the pain associated with that is nothing compared to the pain from the arthritis they had before surgery. Stated another way, everyone I know that has had a joint replacement surgery done has said they wish they've done it sooner and they don't regret it whatsoever. The reason they want it sooner is they could have got all that pain out of the way. They could have got a better range of motion. They could have got back to doing their daily activities and things they love to do, like their hobbies, playing with their grandkids, going golfing. A lot of clients, they like to put off getting a joint replacement done because, it's scary, right? You go in for surgery, you're scared of the pain, you're scared of something going wrong, right? But I'm here to assure you that, there are risks associated with getting a joint replacement done, but just know that people that do have the surgery, 99% of them say, thank God they had it done because they have such an improved quality of life after the surgery. Okay? Another thing I like to tell you too is, being a physiotherapist, I treat a lot of clients after having a joint replacement done. If you elect to have the surgery, you definitely will need physio after. That's not a question. And the rehab process isn't that bad at all, right? A couple months and you're back to doing what you love to do. I hope this video is very informative. Again, I just wanted to talk about 3 things you should consider before electing to have a joint replacement surgery done. If you have any questions, comments, you want me to cover something else related to this topic, please leave a comment below, right? If you have a family member or a friend or a client of your own that you want to see this video, please share it with them. Please like this video so that more people can see it. And once again, my name is Cody Dudgeon. I'm a registered physiotherapist and I practice out of Toronto, Ontario, Canada. Thank you very much for watching.